I'm going to probably just kick off and we're going to let others carry on joining in, because if you're like me, your cup of tea gets quite cold. The most important part of today, for me, is this, cake. So this is our cake that we've made for you today, so thank you for joining us. It was my son doing the icing. That was his attempt with strawberries. So thank you very much. If you want to, just quickly put your video on and you can show us, or you can just put it up to your video, your cake that you brought with you to the cafe, because this is all about having fun. Can I see people? I'm hoping Alex and others. Oh, there's Rachel with hers. Rob. Brian, you haven't got anything. Kate, what have you got there? Take your microphone off, Kate. What have you got? Oh, she's not got her microphone off. Who else has got cake?
No,
Martin?
sorry. It's courgette muffins.
Courgette muffins. Martin, what are you eating?
Sadly, my son made a big cake at the beginning of the week, and I ate the last piece yesterday.
That's not good. Gordon, what are you eating?
So I'm cakeless.
You need to take your microphone off. And Crawford's got a banana, by looks of it, which is very healthy. I would have the banana cake. I'm looking to see what Valerie, UK Valerie's got.
I've gone savoury. I've got a cheese scone, which is the flattest cheese scone I think is possible to make, but it's tasty. It's got lots of cheese in.
Oh, fab. Rennie, you're holding something. What have you got?
They're Dutch egg cakes. So there's no butter in them, but I made 6 and I've eaten 4 already.
Wow. Okay. Marion, do you have something there?
Sorry, was that me?
Yes.
Yeah, I've got German apple cake. I don't know if you can see it. I'm not seeing my screen at the moment. I'm seeing just about 20 people, not me. Yeah, made it last night and there's only 2 slices left. There are 3 of us though in the house.
And Roland, you had something up there as well, didn't you? You'll need to take your microphone off, Roland. Ranald, do you have anything? Did you make anything with the kids? He's gone quiet.
Somebody made something with the kids. I didn't, but can you see it? I can see my screen.
I'm trying to get down now. James Gleave, Patrick, Sarah, Richard, Andrew, what have you got there?
I had a bowl of grapes. I'm actually trying to be healthy. I say I had. This was meant to last me the whole day, and it probably lasted about 10 minutes, if that. So yeah, I'm out.
Anybody else got cake? Because it is important when you're in a cafe to be talking about cake and scones. Believe me, I'm a connoisseur of scones.
Can you hear me now?
Yes, I can hear you now.
Brilliant, that's great. This is homemade ginger cake, and it was made by June Hay, who should be the person talking, but she's cycling a round trip of 26 miles to do the shopping.
Wow. That's sustainable, and are we on rural roads, are we?
It's so quiet in Dumfries and Galloway that even on the main A713, there's going to be very little traffic.
Well, that's good news. Good news indeed. So we've got our cake, we've got our coffee, and we're going to kick off. Some of you probably are zoomed out completely. Some of you aren't used to Zoom, so I'll just quickly fly through a few housekeeping things. Please do mute your phones. The number of calls I've been on recently where other people's mobile phones have rung is annoying. If you're going to be sharing your video at any point in time with audio, you don't want to hear emails pinging either. This is about sharing ideas and being positive, okay? We're not looking negatively, we're needing energy and thinking forward. If you found the chat box on the right hand side, I believe it is, please take 2 seconds just to introduce yourself, say who you are, where you live, UK, Ithaca, Finland, France, Italy, wherever it may be, and just say what your day job is. From a Zoom point of view, I have got various backups in place because, like many of you, I'm rural and sometimes the internet goes down. So at the moment we're keeping the video on, but you're all muted. But we may have to change that to videos off if things come unstable. In the chat box, if you haven't already used it, please do, as I say, introduce yourself, but you can either contact everybody that's on the list, or you can private message somebody. So use that as an opportunity. And I do know 1 or 2 people sitting on this call that have used that to their benefit already and made new contacts in different situations. We are recording this for those people that aren't able to attend. If you have an issue with the recording element, please do let me know. You can play around with your pictures, and you can put it into different types of views. So if you want to see everybody, there was over 70 that signed up for today, which obviously not everybody's going to join. But if you want to see all those mugs and pictures and faces, then go to your gallery and put show grid video. It's quite handy sometimes. Zoom can be a bit temperamental, but if things are going well, please use the interaction buttons that you will see down on the bottom of your tab. You can put a thumbs up and it will appear on your screen and I can see you putting a thumbs up saying that's good, and just make sure you use the chat box. Finally, if you have a technical problem and you end up having to leave, either put something in the chat box or drop me an email and we'll try and help you through. So I'm going to hand over now to Alex, who's going to share Ant's presentation. Ant is joining us, I'm going to just show you here. Ant is joining us by phone, so I thought I'd give you a bit of a facial recognition for him here. And then we're going to have Andrew speaking as well, so I'm sure Andrew's going to swear at me for using that photograph. But if I can hand over to Alex, and he will put Ant's presentation
well, I think,
up for you.
Ant, are you putting your own slides up? I think that's the plan, isn't it? If you can do a slide share, Ant. Share screen. Shout if you can. There we go. Boom, boom. Just make sure you're not on mute, Ant.
Ant, you're on mute.
There we go, guys.
There you go. I've unmuted you, Ant.
Yeah, can everybody see my screen?
Yep, you just need to put it into presentation view.
Good to go? Everybody hear me okay?
Yep, you're good to go.
Okay, thank you, guys. So this is a follow-on presentation from when Jenny kindly invited me to speak at Carnoustie back in October at the Rural Transport Conference. So the plan is I'm going to take you through what DriverNet does very quickly, and then I can update everybody who saw the first presentation or people who are new to it in terms of what actions we were given at Carnoustie, and then what we've done in the COVID response as well at DriverNet. So we take people from this on the left-hand side, dispatching drivers with paperwork, old Nokia phones, paper printouts into the field where they're unconnected, but perhaps using their own smartphone. And we take them into the 21st century and give them a digital platform where central teams can dispatch people through the web portal. And then we have an app for drivers and also an app or SMS messages that go out to customers in the field, passengers. So the first thing we do in terms of transforming from paper to digital is we put in all the paper-based pre-trip inspections and make those digital so they can be performed online through the app and then securely stored in the cloud. We then give all the drivers the route management and messaging, so you can see here, they know exactly what stops they have to go to, and we also profile every passenger as well. So within the profile, you can see special instructions at the bottom if they need to get access codes or any confidential information on the passenger as well. And we also do precision navigation, so we can actually pinpoint where the person's house is on a map, and then we navigate the driver to that position as opposed to relying on Google Maps, which we all know can be quite unreliable in terms of location. And this is where we look like a standard kind of tracking system. So central dispatch teams can see everybody on a map in real time, and then we can get timestamps of when people have arrived. Very good from a safeguarding perspective. And you can see here on the right-hand side as well, we also send out SMS links to customers. So it can just be an SMS alert if they have a standard non-smartphone, or if they do have a smartphone, they can tap the link and then they can see the vehicle traveling in real time towards their house. We also do incident reporting and well-being checks as well from a safeguarding perspective. and we do route optimization and standard telematics within one system. We enable real-time and demand responsive changes. So if anything does change when the driver's out in the field, the central team can update the route for the driver, and then the driver's route is amended without any need to be notified of it. And we have a people directory as well, where people can build their own trips if it's an ad hoc route, or if maybe there's no central teams in the office that day. So that's the platform in 1 or 2 minutes. When we built this platform, we noticed there were a lot of problems out in the field. So my background is in kind of freight and logistics, which is what DriverNet was originally designed for. We were given our first pilot in passenger transport with a local authority. And after kind of 6 to 9 months, we realized from speaking to a lot of our customers or people that we piloted it with, there was a lot of problems out there. So you can see at the top, we're looking at dial-a-ride systems. We're about to launch in Merseyside in England. Uptime is probably about 30%, so 70% of the day there's nobody on board, and it's essentially a very expensive passenger service, but in an 18-seater bus that's subsidised by us, the taxpayer. And in schools and community transport, we were seeing vehicles might be used for 90 minutes in the morning, picking the kids up and taking them to school, and then they're parked up from 9 o'clock to 3 o'clock. So there's these huge costly gaps throughout the day. And likewise, the picture at the bottom is the local authority vehicle was one that was using DriverNet, and then you can see the NHS ambulance and a private ambulance next to it, and a taxi. So I was down there just getting some photos for marketing purposes, and our guys were inside with everybody else for about an hour and a half. The taxi driver was taking one person 4 miles away. We were taking one person 1 mile away, and the NHS and the private ambulance were taking people 10 and 14 miles away. It's a huge costly problem, and again, a real kind of burden to the taxpayer in terms of transport inefficiencies there. And just to add, to finish my point off, all 4 passengers could have fitted on the local authority vehicle and done in one route. So that's what we just talked about in terms of the gaps there in the morning, huge gaps in the afternoon, and then what's the opportunities, what can we do with these vehicles? So this is what we propose to do. We want to upgrade DriverNet, or we're in the process of upgrading DriverNet, so into a smart app with routes and booking, so smart ticketing and card and payments as well. So we can actually fill the gaps. If you see here the user cases, what can we use them for in the morning? We can get NHS and non-medical workers to work, local authority staff. We can get 0 hours workers and the general public to work as well, as opposed to having to use regular buses or drive in. And then likewise in the afternoon, the gaps there from 10 till 3. I think we said in the previous slide, Oxfordshire Council have told us that they paid £12 million in ad hoc taxis in 1 year to get people to hospital or to GP appointments. So it's about kind of utilising these vehicles that are already paid for by the taxpayer in smarter ways throughout the course of the day. And then likewise at night, we'll revert to kind of reverse logistics, getting people from work to back to home, or we can use these buses for evening economy or twilight shifts as well. So these are just some of the features that we're going to touch on in terms of what we're now adding to DriverNet. We've already mentioned about payment and booking systems within it. We're going to have a near you feature. So just because somebody isn't using the system or isn't aware of an event, we'll use AI to ping that person to say, look, there is a vehicle coming past you at a certain time going to this location. Would you like to join it? And that way we can ramp up utilization of these vehicles. You can see from the main screenshot of the app, we're going to have an events calendar. So if you think about communities, many events will happen, or classes or activities will happen, but nobody necessarily knows where they are all in one place. That's what we want to do within DriverNet, but at the same time allow people not only just to view the event or the activity, also book transport to it as well. And again, really ramp up the utilization. Obviously, when we build DriverNet, a lot of our customers have kind of special needs or are vulnerable. So we're going to have all the accessibility features. We're going to allow them to book by SMS or web or the phone as well. And then from a dual control perspective, we don't want to rule out any people who are non-app users or non-technology users. So their friends and families might be, so they can book these journeys on behalf of them and then coordinate it with their friend or the family via the phone as well. So in October, that should say 2019, sorry, when we spoke at Carnoustie last year, I pitched exactly what you guys have just seen now. And this was the feedback that we got. Obviously, the first question was about cost, appreciating, you know, the restricted budgets of community transport. First piece of feedback was that $29.99 per month was too expensive. So that's what our customers are currently paying now. And actually, in comparison to other competitors we have in the market, it isn't that expensive, but we took that feedback on board. Secondly, it was the connectivity issue. Obviously, no mobile signals, no internet, not spots, and no smartphone. So we onboarded that information as well. And lastly, we talked about collaboration. So, you know, I think one of the big themes was, and I know rural communities are perhaps a lot better than suburban or urban communities at this, but how can we utilize all our vehicles better in rural areas as well as in suburban areas? So that was the feedback, and I think we are, what, 6-7 months down the line. This is what we did. So we built DriverNet Go, which is a really kind of light version of what DriverNet does. It gives customers the core features of DriverNet, but for half the cost. And then from a connectivity point of view, we've added in an SMS gateway. So that means that people can now just book through the app. So we can book journeys on DriverNet through SMS as opposed to smartphone. We've built in an offline working mode as well. So it doesn't matter whether you're in or out of coverage, we can still do that. And you probably saw that we send SMS messages and links to passengers as well. What we did is, for passengers that we recognize don't have smartphones or even a mobile phone, rather than send an SMS message or an alert or notification, it sends a voice message to that landline of the person, and we'll just read off text to say, a vehicle from X local authority has been dispatched and it's on your way. So we're safeguarding the arrival of every delivery as well. And then in terms of collaboration, I think October was the first time we pitched this. In the wider world, we won a local innovation or a regional innovation contest last summer, kind of pitching the Uber vision of DriverNet. But we then pitched what we pitched at Carnoustie down in London in a national competition, which I'm pleased to say we won. It was the Future of Mobility Award run by the Connected Catapult. And off the back of that, we got a lot of, we made a lot of connections on the day with local authorities. And it was kind of really good timing just before Christmas and in January, before the Department for Transport launched a rural mobility fund. I think it was back in February or March. So we were already engaged, kind of talking to councils about this space as well. Now, unfortunately, it's only for English councils, but we did kind of get engaged with about 4 or 5 different councils at the time. 2 of them who we're still speaking to, but obviously the impact of COVID has had a serious impact on the capacity of councils kind of wanting to get involved in that. But we do see it as an important part of councils' COVID response as well. So this is other activities that we've now been involved in during COVID. So from a rural perspective, anybody in the room may be familiar with Beata Kubitz. She has admirably set up her own e-cargo bike delivery service in Todmorden in North Yorkshire. So that's, you can see one of the bikes there, and they're delivering food from markets and retailers to vulnerable people using the e-cargo bike. So they're now using DriverNet. We have park rangers in the south of Wales using DriverNet. We've recently become involved with all the blood bikers, transferring urgent bloods in between sites in the northwest and rural Lancs in England. And in St Helens, where our first customers on board, they've now started using DriverNet to do the vast amount of extra security patrols that they have to do because of COVID-19. So that was DriverNet in hopefully under 10 minutes or so. There's our details. If anybody would like to get in touch, please give me a shout. Thank you very much.
Thanks very much, Ant. And you've done a lot since October in Carnoustie, so well done.
Thank you.
Any questions for Ant, please do put them in the chat box. And I'm going to welcome Kevin, who's joined us from Australia, where he says it's beer o'clock time, not cake time. So he's the lucky one with the beer on a Friday night. I'm now going to hand over to Andrew Stewart. Now, this is going to get techie. He's taken this to a whole different level. Other people have asked me, are we going to get the slides? I think Ant, you'll be happy to give the slides over, and so will Andrew. But Andrew's is quite techie, so I might have to PDF it. So I'm going to let Alex share the screen with Andrew, and hopefully we can then get Andrew started.
Yeah, I think Andrew, it's over to you. I think if you can just do again the share screen, hopefully bring your slides up.
It looks different. Let me see. Right. Share computer sound, optimize for full screen video. But hopefully this will just work.
We all know that transport and health are intertwined.
Okay. Was it not working?
I just see a blank screen. I don't know about anybody else.
Zoom gave me the option of share screen, so
there may be some lag between the video and the.
I'll tell you what, if you give me a second, Jenny, if I email you a YouTube link, would you be able to?
We can do something. I'll open my email because I shut it down so it didn't ping.
Right. Build the anticipation in showbiz.
Well, I built you up because you made it quite techie. So that's where I'm starting to get a bit concerned. Because me and
need to learn. I need to learn to stop overcomplicating simple things. Right, mail.
One day, Rodney.
Well,
so I'm Andrew
Stewart. Just quickly fire some of the questions at Ant while
sure.
I'm getting this sent through to me on email. Rob? Rob's not there.
I am here, yes, sorry, I was just unmuting myself. We don't appear to have any questions at the moment for Ant.
Oh, I thought we had, okay.
Questions, please put them into the chat box and we can ask Ant for you.
Brian, I'm sure you have a few questions, amassing that is. If you can keep it brief while I get this email sorted, that would be appreciated.
Not really any questions on it. The DRT software problem is not the biggest problem to try and solve the solutions. Great having technology, as you know, we were working on this 20 years ago. It's how we actually get stakeholders to work together. And there was an excellent presentation showing that each sector had their own vehicle sitting about because nobody talks to one another, nobody wants to share budgets, resources, data, and we've had this technology, and other countries managed to, like Denmark just now, one system, whole country, working together, coordinating everything, works brilliantly. The savings are absolutely in excess of 300%, and it's not rocket science. So it's good to see technology coming on. We have got all these apps now. Apps can help, but it's the mentality, and sadly, given I'm currently working with about 11 countries at the moment, the UK still cannot work together to pool resources. I've got examples of vehicles lying about in areas that have never moved for weeks, and people renting cars from Arnold Clark to do things. It's yeah, so the technology is there, it's good. Trying to get people to pay for anything just now is not easy, and that's how we get the services to the people that counts. I'll shut up now.
Thank you. We've got a few questions as well, so we'll come back to that. But I'll press play and hope rural mobile broadband works for 10 minutes and 3 seconds. Here you go. Oh, sorry.
We all know that transport and health are intertwined concepts. This was recognised in the Grampian region in 2008 when the original Health and Transport Action Plan, for short HTAP, was produced. In 2014, this document was refreshed. The purpose of the HTAP is to enable providers of transport, health and social care services to work together in a more coordinated manner in order to improve outcomes and efficiency of service delivery, both in reducing the adverse impacts of transport choices on public health and in improving access to health and social care. The document presents 2 themes and 2 visions, each overseen by a subgroup of representatives from partner organisations. The vision for transport and public health is for people in Grampian to choose to travel by active modes, such as walking and cycling whenever appropriate, and to have the ability to do so conveniently and safely in order to improve activity levels and public health, and for everyone in the region to live without unacceptable risk to their health caused by the transport network or its use. The vision for access to health and social care is for everyone in the region to be able to access the health and social care they need, and if transport is required, for this to be appropriate, convenient and affordable, and for environmental impacts of journeys to be minimised. The work of the 2 subgroups is overseen by a steering group formed from management across health and transport sectors. Each of these groups meets quarterly with different projects set out in work plans working towards arrival points on a 5-year roadmap. Each year, a report is produced and submitted to community planning partnerships, partner organisations and to national partners such as Transport Scotland, Mobility and Access Committee for Scotland, Community Transport Association, SUSTRANS, and so on. The programme, its groups and projects are supported by a dedicated programme manager. The post is jointly funded by Nestrans and NHS Grampian. The post is hosted by Aberdeenshire Council. Over the past few years, there have been a range of activities to promote joint learning and added value encouraged through HTAP. Out of this has come many well-received events and projects. The Grampian Volunteer Transport Awards is one of the initiatives created by the Programme Manager to support recognition of community transport. In 2020, all being well, the 5th of these biennial events will take place. The Travel to Health and Social Care Information Centre, or THINK, is now well established as the one-stop shop for NHS Grampian patients requiring advice and information on attending appointments. The project also operates as the point of booking for 2 current community transport projects providing transport to health. A lot of time and patience has been spent trying to build this into more of a coordination hub, sharing of vehicles, and so on. The project evolves, is well regarded locally, has received a Bronze COSLA award, and neatly demonstrates the value of partnering, sharing resources, and coming together to assist NHS patients. The Mobility and Access Committee for Scotland and the Community Transport Association have both recently highlighted HTAP and THINK as best practice. As part of this work, partners have mapped community transport coverage across Grampian. Joint training on dementia awareness was delivered by Alzheimer's Scotland for a combined audience of health and transport professionals. The Faculty of Public Health came to Aberdeen to deliver a day of training on how to jointly evaluate jointly funded projects, myths of behaviour change, and the HTAP format, which should be used to drive more collaborative evaluation of partnership working. In terms of public health issues and transport, work has been done to brief transport and health professionals on each other's perspectives, priorities, and so on. This has included taking part in the evening talk series arranged as part of the Civitas Portis project. Food for thought lunch events were arranged to engage stakeholders on issues such as, can everyone travel with confidence? And is active travel inclusive? The feedback from these events was very positive. The outputs were shared with those sitting on HTAP groups. Through HTAP, efforts have been promoted to increase the active travel work of NHS Grampian, including refreshing their travel plan text, encouraging more funding bids to organisations such as Cycling Scotland and Sustrans, and promoting sources of funding for NHS Grampian to access funds for greening their fleet. Just prior to the lockdown, the programme manager presented to an audience of managers and elected officials on the subject of social isolation. For anyone who doesn't know, the evidence is that prolonged social isolation is worse for our health than smoking or obesity. Then COVID-19 arrived. The past 2 months have been a difficult time for everyone, but the organisations involved with the Health and Transport Action Plan have done tremendous work that would have seemed unimaginable at the start of the year. Driven by necessity and the suspension of normal practice, a lot has changed. In terms of transport and health, the spirit of collaboration has been impressive. With public transport all but shut down, THINK, which is staffed by Aberdeenshire Council transport officers, have taken on responsibility for coordinating transport for NHS Grampian staff getting to work. THINK is coordinating requests from hospital staff to be taken home because they have developed COVID-19 symptoms at work. Outside of office hours, this is being done by the NHS Contact Centre. THINK is coordinating transport requests from Scottish Ambulance Service, NHS Grampian, health and social care professionals, and members of the public, for example, those signposted from the Grampian Community Hub. Transport is available for outpatient appointments, either one-off or regular, hospital admissions, and discharge. Aberdeenshire Council is operating patient transport for Aberdeenshire residents. Aberdeen City and Murray Council are also operating transport. Attend Anywhere online medical consultations were rare, but suddenly became critical to keep people at home. In the space of weeks, GPs report a 90% drop in face-to-face appointments. Services which previously people had to travel long or difficult journeys to access are now a click away. This will have lasting effects on both health services and patients, as well as the transport sector. Hundreds of millions of health miles may not be necessary in the future. As a result of the COVID-19 crisis, organisations have come together to share transport resources. This has been an aspiration of the HTAP for some time and could be helpful in the development of the new normal. With many education and social work transport services suspended, the local authorities have made preparations for their vehicles to assist the NHS in the movement of patients, potentially in the management of excess deaths and the movement of the deceased to funeral directors, and so on. Charities and local authority workers have stepped up to deliver prescriptions and food. Many will have observed and experienced a different lifestyle during this crisis, perhaps more active, perhaps more isolated. This has given hope to some in the active travel lobby that this will see a change in our towns and our cities. Events also highlight the importance of how we connect, maintain our social connections, and the ways that transport can help and hinder placemaking. For others, it will have been a time of bereavement and poor health. Perhaps job losses will be in many minds. The future is uncertain, the realities harsh, but there are lessons to be captured and built upon. HTAP is like life. It's a journey, not a destination.
So I'm just going to switch that off. I'm going to hand over to Andrew just to do a wee resume, if I may, while I sort out the tech.
Hello. Sorry for the technical problems, and I hope the video was sort of clear. I was working on it yesterday, thinking I'll just put together a few slides, and ended up working on it until the small hours. So it is just a sort of amateur film, but I thought it would maybe be interesting to try it rather than me doing my usual ramble. So thanks Jenny for the invitation and the opportunity to share the sort of journey that we've been on with the Health and Transport Action Plan.
Yeah, there's been a lot going on in the area from a rural perspective as well within COVID, but I'm not going to focus totally on COVID because we've all been there, done that with lots of webinars recently. I'm going to fling over now to Rob for the questions which I know are in the chat. If you want to, at some point in time, Rob will unmute you so you can actually speak freely, because at the moment the internet seems to be standing up. I have to say, as a cafe goes, I have to make an apology. I haven't got any staff to come and refill your coffee and your cake at the moment. I'm missing that refill. So if you want to go and get a refill, by all means do so. Yes, Crawford, I see it. Mine's empty as well. It's not good. Anyway, over to you, Rob.
That would be great. We have a first question from Rachel Murphy, but unfortunately I can't unmute people from here for some reason. So
I can unmute myself.
If you can unmute yourself, that would be great. Thank you, Rachel.
Yep. So, and I'm just like, it's amazing how much you've changed the product since Carnoustie, and then obviously again in response to COVID. And I'm kind of wondering, when we go into the quote unquote new normal, what do you think you're going to bring from COVID time with you? What are you going to leave behind as an emergency situation?
Yeah, I think where we always wanted to go, and this ties in with a question that somebody else has asked on kind of social isolation. If we look at some of the other products or other services that we've seen out in the UK, so for anybody outside the UK, demand responsive transport services, we've had Ariba Click, that they've not quite wound down. We've had a service in Oxford by Go Ahead that's recently wound down. We've seen Ford Chariot fail. That was both, you know, in the UK, the EU, and over in the US as well. And from our point of view, we think that there is a place for demand responsive transport, definitely, but it has to be centered around the community. So the focus should be on the community and the citizen, and not the corporate traveller and the city, which is what a lot of these services, you know, it's why they're failing to kind of reach commercial viability. So that was always the ethos that we wanted. And obviously you can bang the drum on that as much as you like. It's very hard to get heard. But now I think post-COVID and in the new norm, people are both going to be wanting to get out more, or they're going to have to be prescribed to get out of the house more. So we kind of see DriverNet becoming part of social prescribing, I think, is part of your the answer to your question, Rachel.
Okay, that's helpful, thank you.
And not just social prescribing, you know, it can be used to self-prescribe. So rather than people need to be prescribed by a GP to go out and do this event or go to that event, you know, where we want to go with it is it's not just about it being an online solution. We can advertise these events through local papers as well. So everybody's included in it, and then you can book in via the phone.
Excellent, thank you very much. Rachel, if you could just mute yourself, please. And Kate Pagborn, you have a question as well for Ant. So I don't know if you could unmute yourself, please, and ask your question.
Yeah, thank you very much. I think this is quite a good follow-on, actually, from Rachel, from what you were, how you answered Rachel, because I was wondering whether there's been any evaluation of the social impact for the beneficiaries from the Near You feature, which is obviously quite closely related to what you were saying about social prescribing there, and the benefits of combating isolation, for example.
Yeah, well, the answer, the direct answer to that is no, we haven't. But what we have done, Rachel, is as part of the COVID response, Innovate UK put out a call to action for startups. So we put that in there, and as part of the funding that we have, we've allocated X amount of £1,000 to that to go out and for somebody to kind of analyse and evaluate the potential benefits, you know, across kind of social isolation. What's the benefits of making people more physically active? There's many barriers in places that stop people leaving the house, getting to the bus stop, or, you know, needing a door-to-door service. The door-to-vehicle leg of the journey is problematic for many, many people. And the fact that they don't travel because of that barrier, if you remove that barrier, then yeah, what are the potential benefits? So that's a piece of work that we want to do. And if you you can help on that, or you know somebody who can, then please connect us to them.
That's good to hear. Thank you very much. Well done getting the money.
We've not got it yet. We should have found out 2 weeks ago.
Gosh. Okay.
They've been inundated by, I think, about 4,000 applications. So hopefully we'll be, you've got a 1 in 20 shot anyway, statistically speaking. So hopefully we'll be a 1 in 20.
Okay, good luck.
Thank you.
Thank you very much indeed, Kate. If you could just mute yourself. Alex, I think you just wanted to ask a question about DriverNet and integration with MAS. I don't know if you want to elaborate on that a bit more, Alex.
Adam.
It was Adam Reed, wasn't it? I think I had down. Rob.
Apologies, sorry.
He always forgets me. I'm easy to be forgotten.
This is you.
Hello, Adam. How are you?
I'm good. Yourself?
Yeah, very good. Thanks. Yeah, it's a definite yes, isn't it, in terms of integration? We're actually speaking to Blackpool Council, Blackpool Council at the minute, in terms of they have an app for people in the community, telling them what's on. So that was kind of something that we saw as a definite kind of first opportunity there. And then I think in general, the answer to your question is, you know, apps like City Mapper that focus on, you know, mega cities. So I think London and Manchester have it in the UK. You can then apply that methodology and that approach to every town in the UK, because DriverNet could well be that kind of the first tier. So the first kind of stop within a wider integrated piece. And I think it should be quite a simple integration to do as well.
So have you got the integration APIs for, you know, Trainline and the global Hitachi system? Have you got the integration potential for that?
We have, yeah. It's on the roadmap. I think it's definitely somewhere where we want to go. What's critical to anything in this field, you know, when you're kind of one of the first entries into the market wanting to do it, is, and you know this yourself, Adam, from your business, we need, you know, everybody on board here today, we need their support. We need to get as many councils behind it as possible, and just try to pilot it with 1 or 2 kind of councils. And we don't want to kind of restrict that just to working with English councils either, by the way. We've got customers in Wales and we're trying to break into the market in Scotland. But yeah, we need that support. We need to get behind the movement as it was, and then get the finances to do it. Obviously, we can't just build it and hopefully people will buy it. So that's why we're kind of going down the Rural Mobility Fund in England, and also hoping to get the support of Innovate UK in the shorter term as well.
Okay, so on the roadmap, not quite there yet, but we'll be there soon.
Yeah, we just need to get, I think, 1 or 2 pilots up, and then at that point, then that integration piece will become part of that pilot, whether it be with a Blackpool or, you know, an Edinburgh or a Glasgow. Yeah.
Okay, fantastic. Thank you.
Perfect. Thank you very much indeed, Adam, and apologies for getting your name wrong, trying to do 100 things at once here. So next question is for Marion Marsh about HTAP and bike sharing. Marion, I don't know if you want to unmute yourself, please.
Yeah, hi everyone. Some of you and I work for Como UK, and we're sort of spreading the word of information and sort of helping people that might want to set up bike share or car share, e-bikes as well. And I put a question on the chat, just asking if HTAP were interested in bikes. I got a short reply back actually to say, yeah, they do have a scheme with some share bikes, which is great. And it's great to connect with other people that are interested in this sort of thing. So yeah, my question was that. It's been answered on the chat, thank you. But if anybody at all is interested in shared transport, do get in touch with me. I'm sort of happy to either answer anything myself or pass on to other members of Como UK. My specific job is raising awareness with planners, developers and the like. But I'm very, very interested to hear about aspirations, problems, challenges, everything. Thank you.
Great, thank you very much, Marion. And Brian, I think you wanted to talk something about EU best practice. I don't know if you want to have a talk to the group about that, and any questions?
Yeah. The European Union has 2 projects, Smarter and Smarter 2, which is to guide future transport investment for all 27 member states. And we have a website which I've put the details out there. Jenny, if you could circulate that to everybody, you can access what's going on in Europe. We have currently got 8 pilot sites going on across Europe, just now doing everything from car sharing, bike sharing, e-mobility, DRT, book a bus, post-COVID, and for normal circumstances. We're also looking at the integration of, in rural areas, food deliveries, sustainable food, accessing people to get into the work in the rural areas without having cars. We're actually looking at car brokerage schemes, given that most people now are not driving, particularly the elderly, how they can actually start accessing some money for hiring their cars out. So we've got projects across Europe. We could go on for hours on this, but yeah, and we've also, since COVID, developed an app, as everybody else is doing, for being able to book school transport, allocating the kids to seats, PPE instructions for the driver, the cleaners. The parents can actually see where their kids are at any time. The school can see where the kids are at any time. Social distancing between that. We're looking at delivery of medicines from centralised hubs to try and restrict the number of vehicles going into villages, trying to keep areas clean. We're setting up distribution hubs that are then served by local people to keep more, well, in some instances, dozens of vehicles are going into areas where previously hardly any went, as more people are shopping by internet. So all this best practice is out there. We're sharing that. We're working with the tech industry globally. I've actually put a request out to Mass Scotland if Scottish companies would be interested in joining the global campaign to develop technologies. This is a global problem. I'm still waiting to hear some feedback on that. Like some of the other people, we're also waiting on feedback from the UK funding streams that are 2 weeks behind. I mean, throughout the world, these discussions are taking place, and we're coming together as a society globally. Companies are coming together, and I think the UK has got to start looking out and opening its arms. We can bring a lot to people with our background in community transport and the likes. So, yep, if you want any further information, I'm the coordinator for the Smart 2 project advisory board. So I'm not the coordinator for the project, but I'm the advisor for all the sites.
Right, thank you, Brian. I'm just going to keep on that European side of things. And I mentioned earlier on individuals from America. I will come to Finland and others shortly. But Cheryl and Valerie, American Valerie, not UK Valerie, are on the line at the moment. I'm wondering if I could ask them just to give us a bit of a 2-minute review of what's going on in their rural areas at the moment. So I'm going to throw it, hopefully, she doesn't know I'm doing this, to Cheryl first, if she wants to introduce herself, unmute herself, and explain what's going on in her rural areas in America.
Sure, can you hear me?
Yep, I can indeed.
Okay, I'm in my bathrobe, so I didn't put the video on. It's a bit early here. So what is going on? Do you want to know in terms of COVID or just in terms of MAS in rural areas generally?
You can cover both if you can in a short space of time, or whatever suits you. And I appreciate you getting up at 4 o'clock in the morning.
Oh, sure. So in before COVID, I would say there's a few sort of shoots of grass coming up between the bricks kind of thing in terms of MAS. There's a couple of areas where I've seen where MAS is really starting to be planned or taking hold. One, Jenny, I know you know about, which is in upstate New York in Tompkins County, the Ithaca area.
And where Dwight on the line as well. Yep.
Yes. Hi, Dwight. Where Dwight has gotten funding from the federal government to take more steps. There's an area in Utah where 7 counties have gotten together and they're kind of taking the first steps on this. And outside of Salt Lake, you're pretty much in small urban or rural areas in Utah. There's other places where there's first steps happening, but I wouldn't say they're even self-established identifying as MOS, except in terms of companies that are using that term, but they're really not thinking of comprehensive MOS. The other thing that's been going on is that AARP, which is it used to stand for the American Association of Retired Persons. They've renamed themselves just to be AARP. They are really pushing and educating people on what's called universal MOS, so to include all modes, even those funded and operated by some kind of social service, and that's the one that's used throughout Denmark, that they really use as the model for that. In terms of post-COVID, our rural and small urban and large urban transit have really changed on a dime. Many are doing deliveries and not only transporting people to medical care, but transporting their actual prescriptions and groceries to them, and learned how to, do all this comprehensive cleaning day after day. Some of them have cut service to just essential service. Some are really worried about their futures, but some have really stepped up to the plate. The U.S. In one of the pieces of legislation passed early on is giving a lot of funding to transit, both rural and urban, and hopefully that will make a huge difference. And I'll wait for any questions. I'll let Valerie talk now because I know you have other stuff planned here.
Thank you very much, Cheryl. Can I go to American Valerie, because I'll come to UK Valerie at the very end. It's two people the same name. So very quickly, Valerie, can you just explain the work that you're doing with vulnerable people at the moment in rural areas?
Sure, thank you so much for the opportunity. It's 4:59 a.m. so my camera is not quite on, but I am on my second cup of coffee, so the wires are firing. So we work in a couple of different rural areas, and we also are the kind of operating partner for the AARP Right at 50 Plus program. In rural areas, we have two pilots that we're working on, one MOS in a Wisconsin area that we are focusing on deploying MOS in an environment for specifically starting out with employment. And so what's interesting in that pilot is we have Lyft, we have taxis, we have public transit, and we also have been kind of innovative in approaching other small businesses to join as mobility companies. So recently we talked a small business who did security into being a transportation company because they operated at 3 in the morning in a rural area, and we needed somebody who would provide transport. And so we have our volunteers, which we call our freedom drivers, and taxis and so on and so forth. But this ability to pilot these mobility as a service programs in transportation, I don't want to say deserts, but transportation limited areas, we are focusing on, in some cases, asking non-traditional partners or non-traditional participants to add mobility as a service. In the coastal bend of Texas, as it relates, it's a incredibly rural area, incredibly low income, high senior population, and we're focusing on prescription delivery. We partnered with a mental health clinic and also Toyota North America to expand. They've shut down their clinics. They're not allowing patients to go into the clinics, but instead we're actually helping individuals get access to their prescriptions. So the pilots that we're doing in what I would say super rural areas are really just kind of these innovative, who wants to come together, join the app, be on the platform, pass the background checks and the inspections, and you're a mobility provider. So it's definitely a lot of interest and excitement, but it is a little non-traditional, to say the least.
Thank you. I hope this is giving some people some flavour to what's going on, because obviously rural isn't just the UK, it's anywhere. And I'm going to throw to the man drinking the beer. He knew I was coming, Kevin. Kevin's in Australia. He has got his video on, so I'm not sure if he's sharing his beer with you or not. Thanks for joining us, Kevin. Do you want to just give a few brief words saying you've made the effort on a Friday evening to join us?
Yeah, it's a steam ale. I'm not sure you get it in Scotland, but yeah, thanks, Jenny. This is great. Great to meet everybody. I'm actually Scottish. I was born and bred in North Berwick and lived in Australia for 12 years now in Sydney. So yeah, look, we met Jenny and Alex a little while ago. We've been doing DRT, or on-demand buses, as we call it over here. It's a bit more of a Hollywood term over here, for past 4 years in public transport. Sydney was pretty innovative in what they, I guess, kicked off in back then was 10 trials around the city, all different use cases. There was no technology provider, like one technology provider or one organization. It was partnering up, and it was all different partnerships. And it was really a test and learn structure. So we went through, I guess, a pretty intensive, I guess, birth. You had contracts for 6 months, where you had to prove if you'd learned what you'd learned, and if you were going to prove worthwhile things in the next 6 months, then they extended your contract. So we've been going through pretty unique contract structure, pretty hands-on from the transit agencies as well, to make sure that they're actually learning good things. And I guess what's happened is it created a lot of competition here. So instead of having one provider who created a monopoly, essentially got a little bit lazy, you had competition. So Bridge's technology was bought by a bus company. I mean, Bridge, the company that went bust in Boston. Via's been working here with Keolis. We work with Transdev, and there was another smaller company. And we've all been competing against each other for 4 years, trying to improve the tech. If we release a feature that gets, I guess, some good press and some good interest, then we tend to see that the other competitors do it shortly after. So as a birthing ground and a place to prove your product, it's been great. We, I guess, have been doing this a while now. We did it for 4 years. We're now in the US, delivering DRT both in corporate settings and in the public transport DRT setting as well. We don't take on public transport in the chariot model. We'll always work with an operator, and we're always technology. So we've got to we found the place where DRT works, I guess, from a business model. And I guess at the other end, we have learned over the past 4 years where DRT works in certain densities and certain use cases, and it doesn't work everywhere. And there's a lot of, I guess, a lot of failed, quite high-profile cases that you can call upon. But there's definitely a couple of use cases where it works really well. Typically, a feeder system, outer suburbs, rural. It works really well in a rural setting. Gets more people onto the vehicles as well. So fairly recently, we've been in the UK and the Nordics. We work with Volvo in a corporate setting. And Jenny, you wouldn't have heard this. This is hot off the press. So we have a project in the East Yorkshire, which is our first UK project. So we're working with Go Ahead Bus there for the next 5 years, delivering the DRT system there. So I think we're trying to bring our learnings, I suppose, that we've had here for many years into the UK setup, and see, there's obviously going to be differences, different citizen profiles, behaviors, different geographies, very much a different structure. We've got sort of large transit agencies and lots of subsidies, obviously, and I guess you've got per council sort of devolved structure in the UK. So it's very different and different problems. So we're kind of in that learning phase. But yeah, I guess we met Jenny and Alex 6 months ago. So you've been very helpful, kind of helping us out in learning the landscape for Scotland and the rural setup. So we're excited about, I guess, meeting everybody and hopefully do a few more of these and get to know you guys a little bit better. But if it wasn't for COVID,
restrictions are lifted, I believe Annie McElroy is on the call. I think you're coming across for the Mass Scotland conference in September, and I have a feeling if you're not there in person, you'll be virtually beamed in. I think would be the answer. Yes.
Absolutely, I'll be there. I'd actually be living there right now if it wasn't for COVID. I was planning to be back in the UK, but things got thrown around, so our family's kind of, well, I was going to say adjusting. We're not adjusting. We're just doing the status quo. But yeah, absolutely, I'll be there in September. Look forward to it.
Fab. Right, I'll pass back to Rob for the questions because I see it keeps going up and up and up. So I'll come back to those of you that are still overseas. But Rob.
Yeah, no, thank you very much. We've got a few more questions here. Martin Huggett, I think you've got something. You're from Mull, and you've got a question. So Martin, if you want to unmute yourself, please.
Well, it might be in time-wise, and given that you've got a lot of questions, it might be more of a discussion point to pick up in another one. I'm not from Mull myself, but I was doing work there with Terry Hegarty, who's also on the call, who runs a small community transport operator. And we were looking at issues about sweating the assets more with their community transport vehicles, and the sorts of things that Ant talked about, being able to fulfill multiple functions, is fantastic. But the real problem that we were struggling with was just the regulatory restrictions on community transport. And in Terry's patch in the southwest of Mull, with his community transport, he could potentially provide taxi services to visitors in the summer, or even excursions, a whole range of non-emergency patient transport, which would help to then fund and support and keep the community transport going. But of course, there's all sorts of restrictions on it. And in his circumstance, he wouldn't be taking business away from taxis because there are no taxis. The taxi driver retired. But I think that's the real challenge in some of these areas, because it would be great to see communities putting on these services and making themselves self-sufficient. But for me, we really struggle to find a way through the sort of regulatory red tape.
Fantastic. Thank you very much indeed, Martin. I like the comment here from Cheryl. I don't know, Cheryl, if you want to say about the shower curtains in West Virginia. That's brilliant. A bit of innovation there.
Okay. Yes, a transit system in Morgantown, West Virginia was pricing all these different kind of dividers, and then they found that they could get shower curtains, clear shower curtains, for $15 each, which obviously is much cheaper, and it kind of does the trick, because what you're trying to prevent, right, is that direct transmission of the droplets. So it's just as effective. I won't say there's any studies been done, but I would assume it's doing pretty much the same things as the dividers.
I think it's great, people thinking slightly outside the box, which actually is what innovation is all about in its true form. So that's brilliant. Thank you very much indeed, Cheryl. Kevin Orr, you were talking about DRT and DRT adoption, and Rachel, I know you're interested in DRT as well. I don't know if you want to ask your question, Kevin, and Rachel, you're more welcome to join in on this as well.
I'll pass over to Rachel. I've kind of stolen some of the limelight. So over to you, Rachel. You can go.
Thank you. I mean, I don't really have any questions about DRT. I mean, the community transport point around regulation is obviously one that affects all of our work at the Community Transport Association. But what I do really wonder post-COVID is, will we see CT being allowed to do more as commercial operators, particularly in more rural areas, just cannot survive under the pressure of making profit? Whether we'll see, CT potentially be allowed to do more. I think the face of CT will be so different in a couple of years. And as much as we, it's quite easy to talk about the passenger, the nature of CT is often that the drivers or volunteers themselves are that little bit older. So I think there's just going to be so much change in the next 2 years. The shower curtain idea is an exciting one. and maybe one we can take to members, because they're currently looking at very expensive shields. So there might be a lot of saving in this. So thank you.
Rachel, I don't know if Kate Pangborn saw it as well, but there was something on Twitter, and I'm really bad at looking at it, but somebody set themselves a challenge for doing a partition for under £5, and they managed to, I don't know if anybody else has seen it on Twitter, but they managed to buy various bits and pieces and did it for like £4.97. So there are solutions out there, and if I see it on Twitter again, I'll tag you and share it.
Please do.
It's quite interesting.
We've been speaking to schools looking at doing it with their design and tech departments and shipping those out to all their local buses. So, you know, there is clearly a lot of innovation at the CT price range of the scale.
Rachel, if I can jump in, and sorry, Rob, just to add to that. So,
please do.
With community transport, in one of our use cases here in Sydney, and because obviously a lot of their core trips are done traditionally between 9:30 to 4. They've got this excess capacity, you know, between 4:30, 5 o'clock in the morning to do a commuter transport. So that's exactly what they won a contract on, was to use the existing assets to transport people to and from local train stations and local ferry stations. They've got the assets, so everything is essentially additional funds for supporting their business. Well, normally those vehicles would just be sitting waiting. So there's it's happening, and I guess you got to look at the profile of when those assets can be used and where it's very doable.
There's a really good example in the Gairloch, which Highland Council have basically bought a vehicle for their local area, and the community has the responsibility to meet the statutory child moving to school responsibilities, but the rest of the time the vehicle belongs to whatever community activity they want to run with it. And that's worked really well. It saved Highland Council a huge amount of money on their school transport, and it's meant that that asset's always available. And it has been a really good way of sweating it. And realistically, I think we'll see a lot more of that. Local authority budgets were getting cut, COVID or not. So I expect we'll see far more options like that going forward.
And I think you've got a great option there, because Kate in the chat has offered to make some wacky designs if you need of masks. And I can vouch for Kate's capabilities in this. So anybody can get in contact with Kate. So well done. Sorry, Rob, I've hijacked you, but we've got about 10, 15 minutes left for final questions.
Kate, if you could do me an alien mask out of the film Alien where it's over your face, that would be great. I'd wear that all the time. That would be brilliant. Actually, Kate Pangborn, you mentioned about the DFT consultation that's open at the moment in the chat. I don't know if you want to just elaborate that to everybody, the importance of that and getting people's views across and back into the DFT.
Yes, they are running a consultation at the moment, and they keep extending the deadline for responses. It's about regulatory changes that are going to be needed for future mobility. And of course, they're thinking of things like mobility as a service, and e-scooters and autonomous vehicles and all the kind of shiny stuff. And they need to be reminded that there are some other simpler things that they could attend to that could have much bigger impact. And I would see that what Martin was talking about and others have agreed with around the issues for community transport being able to increase its impact, being restricted by the current regulations. Now is the time to tell the DFT that there is an opportunity here, and because the IT that's possible now really can make community transport make a difference. So I don't have the link to hand, but I'm sure if you go to the DFT website consultations, it will be relatively easy to find. And I think
We can share a link in an email afterwards, Kate.
Yeah, okay.
And what I would add, as a number of us have already had the opportunity to speak to DFT on various issues, is that they are asking for the evidence. So if you are making suggestions about why this needs to change, then cite examples, whether it's UK or Europe, so that they've got the evidence there, because that's what they're looking for, to be keeping themselves informed. But we'll send out an email later on with that DFT Future Mobility link in it. I think there's a lot of chat going on about masks here, so I think we've got a production rate going. That's what cafes are all about. They're about sharing and exchanging ideas. So we're going to start with masks here for definitely. Right, just a couple more before we conclude, because people will be needing the toilet now. They've had the cups of tea. It will go straight through you. That's what happens in a cafe, isn't it? Rob, do you want to pick one or two final questions?
There's no more real questions actually on here, specific questions. There's more ones open to the group. So Alex Reed's given a couple of interesting sort of general questions. I don't know if you want to open those up for some general chat, Alex, but there's no more specific questions really on here.
Yeah, I mean, I've thrown it out. It's more tourist related, and it's not an issue for now, of course, because we're all kind of in lockdown, but it's more kind of recognising where you do have situations of over tourism, particularly around limited car parking spaces, what role there is for DRT or for MAS to address some of that. I know Rob's come back to it's very place specific, really depending on user cases and what tourists want to do and how much they need their car. But I think we all know that for those rural areas that have benefit but also had challenges around over tourism, what role is there potentially for DRT solutions to potentially reduce some of that car challenge?
Yeah, tourism is going to be, personally I'm involved in some of this, and the tourism aspect is a challenging one for this year. I think at the moment they're looking at the fact that we might not be looking at a season in summer, and we might not be looking at October. So the tourism industry is definitely focusing on the fact that revenue is not going to come in until next year. So it does give an opportunity to actually help put a strategy together for how tourism looks like going forward for people coming to various areas. Obviously, I know quite a lot about what's going on in the Cairngorms from that perspective. But people and cars, 96% of people in the Cairngorms come by car to the area because we don't have the infrastructure. So can we actually seriously look at bringing in, and I know Ranald's on the call, bringing in different services or changing the way things are delivered, and Sarah from Viavans on the call as well, that whereby we don't traditionally keep the bus services that are running around empty. And for those of you that follow me on Twitter, I got rather angry yesterday reading something about the BBC about an urban bus driver in Edinburgh who finds running the bus empty very soul destroying, and I was like, well, welcome to the world of bus drivers in rural areas. This is day in, day out, year in, year out. So as somebody put to me at the beginning of lockdown, I think many people are starting to experience rural living even though they're in urban centres, and that's probably the same whether you're in Scotland or whether you're in Finland or in Italy. On which note, does Patrick from Finland, if he's still there, wish to bring anything to the coffee table? Don't know if Patrick's still there.
Yeah, hi. Thanks for that. So I'm actually half Scottish, but 100% European, and I'm based in Turku in Finland, and work for Spinverse, and we put together these EU funding applications consortiums for national instruments as well as EU instruments. And at the moment, we're actually working on a big set of mobility, autonomous technology, and also EV technology instruments that have just gone in. And one of the interesting cases is in Iceland, actually, where we're working with Strato, which is the Icelandic bus company. And what they want to do is integrate drones with their public buses, so while the bus is driving around Reykjavik, the drone can land on the bus, recharge, and then it can track the bus by about, maybe a kilometer, and it has different sensor packages on it, and it can gather different data in terms of traffic or weather or transport or sniffing the sulfur from the volcanoes. And then the bus company can actually capture those different sources of data and then resell that. And you can spin up lots of new companies around the kind of bus digital service. So that's quite an interesting thing that the Icelanders are working on. And if anyone's interested to learn more, I can I can give you more details on that one. The other thing is that they want to use
you volunteered yourself for a cafe at some point in time, Patrick.
The other thing, of course, what they want to do is Iceland's very remote and distributed, although most of the population is obviously in Reykjavik. But they want to be able to use these drones on the buses for maybe distributing pharmaceuticals, and have them hopping on and hopping off and kind of optimizing that pharmaceutical delivery. And of course, in the main Nordic countries, I live in Finland, but work a lot in Norway and Denmark, Sweden. And we've got a lot of long countries apart from Denmark, a lot of distributed population, people living in archipelagos. So there's a lot of activity at the moment on logistics with drones and also integrating that with other transportation services. So I'm kind of in the middle of quite a lot of that stuff up here in the Nordic region.
Sounds really interesting, but I do think you volunteered yourself for a cafe there. Is anybody else wanting some questions before I pull this together with some information at the end about what's coming up next? Anybody else for questions? Unmute yourself now. No, that means you definitely want the toilet. Let me just get the last slide up. So aside from saying a big thank you for joining us, we created a LinkedIn group called Rural Transport Innovation Group. So go and find that on LinkedIn. And what we're trying to do is to continue this chat and support for people in rural areas, no matter where you're based, because it's great to be able to share some practices. We're going to continue this cafe series, but we're going to do it in bite size. And I'm going to throw the floor open in a minute to Valerie and Rennie, who have kindly had their arms twisted to present on the 5th of June. And I say present because there's going to be no PowerPoint. So can I throw over to Valerie, UK Valerie, to explain just briefly what you're going to be talking about on the 5th of June?
Yeah, thank you, Jenny. Excuse me, we can do PowerPoint if people would like. I just got the impression that folk were getting a bit fed up of PowerPoint on these things. So we weren't aiming to do many slides, but so Renee and I work for Midlands Connect. So for those of you who don't know us, we're a subnational transport body in England working across the Midlands. And last year I project managed a study that turned out to be absolutely fascinating. It was done by the University of Lincoln for us and our partners on the future of rural mobility in the Midlands, with the hope that some of the learning would be transferable to other areas and regions. So the study looked at people's needs and business needs in rural areas. And only once the university had done that did they then start looking at options, including the tech options, but not always tech. So we engaged with about 300 people and organisations, and we came up with a toolkit, which if I hold up, you might be able to see. Looks a bit like that on an A3 sheet of paper. So I'll be talking about that on the 5th of June. And one of the recommendations that we're taking forward is looking at hubs. So Renee will be talking about that on the 5th of June, how we're taking this piece of work forward. So really looking forward to presenting with or without PowerPoint slides and getting some questions and feedback. So thanks, Jenny.
Thanks, Valerie. We're going to keep that to sort of a bite-sized 30-40 minutes so you can have your cup of coffee. And then if Dwight's still awake, he's kindly had his arm twisted as well, because many people have heard me talk about upstate New York and Ithaca over the last 18 months, 2 years. So that might be a slightly longer session, just so Dwight can give us a bit more context in America, but I'll let himself unmute himself. And Dwight, if you just want to just give a wee brief overview of what you're up to and what you can talk about.
Sure. This has been fun getting up so early, and now we do have dawn, and so the Earth does revolve. That's very good. We have a phase 1 of a mobility as a service development we are working on, and I know you're very you've heard a lot about MOS. We have a different take on it. And what that take is that it emphasizes customer service. So not only initially will we be doing multimodal trip planning, which is very conventional, but we're doing multimodal customer service. So essentially assisting people who've had trip failures, regardless of the mode that they have traveled with. I'll just mention very quickly that I work for Tompkins County, population 102,000. We're surrounded by rural counties, and we have a lot of mobility needs. And it's been very interesting for me to sit back and listen to the discussion so far today. It's been extremely interesting. And some of our words are probably different, but the necessity of the work that we are doing is great. So I look forward to sharing with you and answering questions when it gets warmer. Thank
and
you.
now people that have heard me talk about you, Dwight, have a face for what you look like as well. So there you go, no pressure. So those are dates for your diary. They're all going to be cafe size. They're all going to be 10 o'clock in the morning. So unfortunately, Dwight's going to have to get up early again on the 19th of June. So yeah, dates for your diary. If you've got a suggestion for a different type of cafe, short one, long one, let us know. Also, if you want to volunteer behind the scenes to help make these happen and to hear about more what we're up to, then please just drop me an email. But I can't finish off without not saying thanks to my musketeers. I've got a group of musketeers that are a merry gang, and that's Rachel Murphy, it's Alex Reid, it's Rob Furlong, it's Ali McEnroy, Gordon Hill, and I think Stacey, if she's on the phone call here as well. So they're helping me out in the background. We're all volunteering to do this, to bring it all to you. A big thank you for your help, guys, because I couldn't do it without you. So I think that's really all I need to say, aside from, again, thank you to all of you getting up early or staying up late with your beer or bringing along your coffee and cake. We will be sending out bits and pieces to you on email about these different events. And I think we'll also put the DFT link in. But if there's anybody else that wants to put a link in that should be useful, aside from how to do a mask, which Kate can send to me, and we can include that. But also would really appreciate some of your feedback as well as what you enjoyed from today. And hopefully it's giving you a bit of positivism for the weekend, because I know sometimes we just lack a bit of energy. So hopefully this is giving you something good.